Good morning, Maryland. I'm Christian Schaffer. Thanks for joining us for this special Facebook Live along with GBMC. I'm joined by Dr. Jennifer Heller. She is the Medical Director of the Wound Center at GBMC and also the Director of the Vein Center at GBMC. Dr. Heller, good morning.
Good morning.
Thanks so much for coming in.
Thank you for having me.
We have just been talking off camera about all kinds of different treatments for your kids and yourself. Now, people who come into the Wound Center at GBMC might have something a bit more serious issue. Can you talk about what's the difference between just a regular cut or bruise you get out in the field and something that requires a much longer term treatment?
Sure. Just to back up just a bit, a wound, we always hear that term. What exactly does that mean? A wound is an injury to living tissue, it can be anywhere in your body, that causes an opening of the skin. So it can be caused by a variety of different issues, sometimes accidents outside, in our home, it could be surgical. And depending on how that wound develops and how it sustains itself right after the injury, it depends on whether or not you should seek care at a place like the GBMC Wound Center. There are certain characteristics of wounds that I would recommend that when you look at the signs of them, when you should go ahead and seek treatment. If the wound starts to become, is very painful or becomes more painful with time, if it enlarges, if you feel generally icky, you start to develop a temperature, all of those are signs that would warrant further care. One
of the things I hear myself saying to my daughter all the time, who's now 11, over the past 11 years, is that your body knows how to fix itself. You know, generally things just get better, but the issue is sometimes it needs a little help, because not everything is going to fix itself without some help.
That's absolutely true. And there are certain risk factors that put people at a higher risk to develop what we call a chronic wound. The National Wound Healing Society defines a chronic wound as a wound that's been present for more than 3 months. But certainly at the Wound Center at GBMC, we recommend that if you have any worrying signs, you shouldn't be sitting with an open wound in your house and treating it yourself for 3 months. So people who have certain medical conditions like diabetes, peripheral arterial disease, history of blood clots, cancer, those are all medical conditions that make it harder for people to heal their wounds. There are other medications such as blood thinning medicines if people are on Plavix or Coumadin or even aspirin. Steroids as well can also prolong wound healing.
So typically the blood is going to form a scab and the wound's going to heal itself. So what's going wrong where it's just not healing? Like, what's the issue in many cases?
It could be due to poor blood supply to that area. Sometimes we see people who have arterial ischemia, peripheral arterial disease. If there isn't enough good blood flow getting to that area to feed the tissue to make it healthier, it won't heal. The veins also play a role. If people have previous problems with blood clots or venous disease, that can also play a role. And smoking, unfortunately, I had to bring that up as a vascular surgeon. Smoking also really does affect what we call the microcirculation and delivery of oxygen to the tissues. So tobacco use, particularly for a long period of time, will also prevent wounds from healing well.
So it just doesn't heal as well as it would.
Or it could not heal at all, and certainly sometimes intervention is needed.
You know what surprises me is that people who have a chronic or long-term wound like that, you would think it would get infected. That must be one of the issues you deal with, trying to prevent that from happening. But how do you do that, and why doesn't it just happen more quickly without you doing something?
Do you mean an infection?
Yeah, it seems like a wound that stays open, it just seems like it would get infected to me.
And they do. Sometimes we call that chronic colonization. And so you may not have a gigantic, scary horror movie kind of infection going on in your wound, but certainly there could be mild bacteria that's preventing that wound from healing properly, and that would certainly can be helped and addressed at the Wound Center.
So where are we in 2019 as far as your basic treatment for the kid skinning their knee, falling down, stub toe, cut outside? We're now saying for peroxide, yes or no?
No.
No peroxide. How about that? Breaking news here.
No peroxide.
What's the issue with dumping the peroxide on an open wound?
Peroxide generally tends to kill tissues. Soap and water is really the best bet.
Wow.
Yeah, I mean, I remember memories of myself with my parents putting peroxide on my wound and seeing that white foam and feeling like my legs were going to burn off.
You're really doing something.
Yes, yeah, you're doing nothing. You're just hurting your kid.
My daughter is going to be so excited to hear this. I can't wait to tell her.
Soap and water.
No more peroxide.
No more more peroxide.
Soap and water. Now that we've cleaned it out,
Yes.
Are we still good with Neosporin or products like Neosporin and a Band-Aid?
Yeah, and it really just depends on the location of the wound and how long you're going to be treating it for. One of the basic tenets of wound care, which we can certainly follow in our own homes, is we don't really want wounds to get too dry or too moist. So a single application of an antibacterial, antimicrobial ointment like bacitracin is fine. But if it gets too goopy, the wound won't heal properly as well.
Interesting.
And so similarly, if you cover that wound with a Band-Aid for too long, it's going to sort of create a dark, moist environment, which we don't want either.
So Band-Aid or some sort of bandage initially maybe. But
And then certainly take it off, shower, get that dry, and then see where you are.
it needs air?
It can need air.
It sounds like such a simple thing that parents say to air it out, but that's...
Certainly, yeah, and you know, if the wound looks a little bit more complex, and your child is complaining or saying that it's draining or it's hurting or it's in a funny location, that's going to really prevent it from healing, like really over that knee joint.
Yeah.
And there's more tissue than just skin exposed. Certainly, you should come to the wound center.
About how long do you think parents would be concerned with if you're not seeing enough progress with the wound getting better before you start to think, okay, maybe I need to talk to somebody about this?
I would say certainly several days is fine, as long as, again, you know, I'm not a pediatrician, but as long as the child doesn't have any systemic signs of infection, meaning they generally feel well, they're eating, they don't have a temperature, and again, that wound is slowly progressing.
So, and so the other question that I have for you about the wound center is, when you go into your program, people who have to stay longer, what kind of problems can lead to somebody who has a wound that, and this happens, it just doesn't seem to heal, and we're talking about months and months of treatment. What's the issue going on with some of those cases?
Well, certainly as we age, we tend to collect other illnesses, and things tend to slow down a little bit. People's skin tends to become very fragile. People are on a myriad of medications that slow down their wound healing. The location of the wound can be a little bit tricky. And certainly we heal a lot of patients in several weeks, but then there are also patients who take 5 to 6 months to heal.
Wow.
So
Lisa Ann sent in a question about, she must have heard us talking about peroxide, because maybe she was thinking about rubbing alcohol instead of peroxide. I'm guessing that's going to be a no for you as well.
that is correct.
Right. Don't do the rubbing alcohol, Lisa Ann. No peroxide, no rubbing alcohol.
Correct.
Clean it out, soap and water. Okay. I've got another question that came in from Michelle. She has a large bruise. So we're not talking about broken skin now, but it's forming some lumps. It's not healing as well, I'm sure, as she would like it to. Is that something that you could deal with as well?
Certainly if there seems to be fragility of the skin and something is jiggling, it's a very technical term, something is jiggling under the skin,
Well,
it's
yeah,
possible
and it
to
sounds
be open.
unusual.
That's right.
Yeah.
Anything that seems unusual or you're concerned about, although it's not a formal wound, it may need to be unroofed or opened up, and that's certainly something that we could address.
And is that something that can come in and you can fix it? In
Yes.
other words, they don't have to just live with that for...
No, and I
extended
wouldn't recommend it, certainly. We pride ourselves at the GBMC Wound Center that every new patient who calls us, that we will provide them with an opportunity for a new appointment within 2 business days. Because it's concerning to have a wound and be wondering if it's infected or if it requires some additional treatment that you're not familiar with.
Yeah, so what are the dangers that can happen if something doesn't go addressed? I mean, are we talking about things that could go beyond potentially just not having it heal and look like it used to before?
Certainly. You know, if we talk about dog bites, for instance, or injuries in the home, if someone hasn't had a recent tetanus shot, or if someone has underlying infection or issues that can cause this to become much more advanced more rapidly, it is much more important for people to come in and get it looked at.
It seems like sometimes when you mentioned a dog bite, the wound winds up being irregular as opposed to like a cut. Does that make it more difficult to heal?
It doesn't, but sometimes certainly there are areas of wounds that need to be cleaned up, and those can be addressed, and debrided is the term for that, and we do that in the wound center as well.
Got a kind of a technical question, so I'm not sure how many people it applies to, but Jody's curious about it, so I want to ask that for her. Sacral ulcer that has been healed for now 3 years with some surgeries to help this along. What are some tips? What should she be careful of? is there still a schedule of things that she needs to follow in order to continue the treatment going forward?
Jody, I'm glad that you brought that up. The sacrum is the area on our bottom, and you can develop a pressure ulcer if you're lying on that area of your body for a long period of time. So if people have a very long illness and they're confined to bed, or they're elderly and have other medical issues, or young, and it just prevents them from really taking pressure off of that site. A lot of what we do at the Wound Center at GBMC is really multidisciplinary, which means that if Jody were to come in and say, hey, it's healed, but I'm concerned, and we see this actually frequently, what we do is that we really bring everyone together and say, let's talk a little bit about nutrition, because nutrition is very, very important about not only healing wounds that are active, but preventing them from recurring. And so we would talk a lot about protein supplementation and shakes and calorie counts, and perhaps take some blood levels to see how that is. As well, offloading is a big issue for Jody and other people who suffer from pressure wounds. And so we would talk about what to do when you're sitting in your wheelchair or your chair, special cushions, special air mattresses. And we are able to order and help people get coverage and be able to make sure that they're in a place where they're being proactive about prevention
so
of
even
any
if you
pressure
had,
ulcers.
if it is from an incident that happened years ago, there's some help that can be still
Certainly.
gotten now.
Certainly.
Yeah. And let's see, Elijo doesn't know if this qualifies. She had an infected cyst that was lanced and drained. She had felt that it was need to go to the ER for that and had that done about 3 weeks ago. She says, and I'm quoting, still small amounts of stuff coming from it today. Any concerns about that 3 weeks now after having the cyst drained?
Yep. So a cyst certainly has a strong likelihood for portions of it. A cyst is basically a fluid-filled structure that sometimes has fluid or particle matter in it, and it's covered almost in what we call a wall, which is like almost a balloon, if you can envision that. And if that cyst is not entirely, the wall itself is not entirely removed, it can recur, come back, or that stuff in there can still come out. So certainly we do see cysts that are not continually or appropriately evacuated or drained at the initial time, and we can address that at the Wound Center.
That has to be frustrating, because I'm sure she was concerned about it, first of all, going in and had it done, but she may not be done yet.
That is correct.
Yeah.
And we do tend to see a lot of different surgical wounds at the Wound Center. We see patients who have had wounds after knee replacements, patients who have had cyst excisions like she has had, patients who have had C-sections, which is always upsetting for new moms to have to deal with a wound, but we can really heal them very rapidly because they tend to be young and otherwise healthy.
Do some people schedule that beforehand, or is it always people responding after the fact?
It's people responding.
Yeah, when they have issues. Interesting. I was going to ask you about some of the other wounds that you've dealt with, but I just have to ask you this personally, because talking about the cysts and everything else, you must have seen some things that are very difficult for most people to see in your career. How do you deal with seeing patients come in with all sorts of different wounds that A, have to be very concerning to them, but B, have to be somewhat disturbing for a person to look at?
That's a really good question. Well, this may be a little bit off track, but from when I was little, I've always, okay, good, here we go.
Sorry, I'm off track again.
I've always wanted to become a physician, and so I'm a long time in now, but I really feel like it's a privilege to be able to take care of patients. And the really unique privilege I have as a vascular surgeon and as a wound physician is that I'm able to meet people and establish a relationship with them over a long period of time as their wound heals or as their vascular issues are addressed. So I don't know. I don't want to say that I'm desensitized from it, but it's more like, well, we just have to address the problem and get it fixed.
Work the problem.
Yeah.
And I mean, not necessarily with, well, maybe we do with you. Some people we talk, or some doctors we speak with, the issue is that a person doesn't want to come in, or they feel uncomfortable about coming in and talking about issues that involve their health. Whereas in your case, I'm betting at some places people need to come in. I mean, it's time to come and talk to a doctor.
Yeah.
And they're concerned about it, but that doesn't make it necessarily any more easy to talk about. It must be tough for some people to address these issues.
It really is. There have actually been, oh gosh, I've been at the Wound Center GBMC now for 2 years, and I've seen certainly 3, possibly 4 women who have come in with breast wounds who have realized that something was amiss, and they were advanced cases of breast cancer that were not diagnosed because they were reluctant on some level to go to their primary care doctor. And so I feel that that's also great for us, that we're able to hopefully get that ball moving and to help that person deal with a very, very difficult situation. And although it's not a wound per se, it's not a wound that I would want to heal because that has to be surgically addressed. But it's something where we can certainly help and welcome them into the GBMC family and get them treated.
So that kind of is the answer to the question, really, that you're looking at the big picture.
Absolutely.
Because when you see something that the regular, non-doctor might find, oh my gosh, they can't even look at it, whereas you're looking at it as something like, okay, we can help this person.
Absolutely.
Yeah.
And that's one of the great things about the GBMC Wound Center, because we have the resources. So if I see something, for instance, one of the women that I was just previously describing, I'm able to call the breast center and say, hey, I really need you to see this person. Or if someone has a very extensive infection, I can call the infectious disease group and they'll just walk right up the stairs.
Help is available.
Help is available, readily.
Adam wrote in, occasionally a boil that develops into a hole that he says is seeping, and he keeps it covered. He does put peroxide on it at night and something he's calling solar cane. I'm not sure what that is. But he's wondering if there's a way to make it heal more quickly, or if that's an issue where it's time to come and have somebody look at it.
I would recommend that he comes in. Yep.
Just because it's not getting better.
It's not getting better, it's coming back. It's also possible, we've seen a lot of wounds, interestingly. I'm not trying to prevent anyone from going to gyms, but there tend to be some wounds associated with people who the exercise equipment, and they develop wounds, and we realize that it could just be chronic, what we call colonization. And so it's possible that he may need not only this area treated with us, but perhaps also consultation with an infectious disease doctor. Does he need a special soap? Why is this boil occurring? Et cetera.
So you're concerned about the gym. Do you have that concern about where germs are generally? Because you're trying to keep wounds clean and free from germs.
Yeah, I tend to be a bit of a germaphobe, I have to admit. But generally, germs are okay. It's
they're
good that we're on
around.
They're around, and we certainly don't want something scary called antibiotic resistance. And we really don't prescribe as many antibiotics as one would think. But again, it's really taking a look not only at the wound, but also at the big picture of the individual.
Yeah, because the simplest thing to do, people would think, would just be to give them some antibiotics and send them out the door.
Exactly.
But that's not what really is going on there.
No, it rarely happens.
Yeah.
It rarely happens.
So Jody's got another question about bariatric treatment for wounds. And I'm again, not exactly sure what she means by that. Maybe you are.
She probably means hyperbaric oxygen. And we do have hyperbaric chambers. That's concentrated oxygen.
Wow.
And depending on the type of wound and the patient's medical history, we can and do put people in the chambers.
What does that do?
It can accelerate wound healing.
Wow.
And we have a very great state-of-the-art hyperbaric facility at GBMC.
I had not heard of that being used to treat wounds at a wound center. So that's very interesting. Let's roll over real quick again before we let you go. Basic tips for parents treating wounds on the kids in 2019. What's the best advice?
Okay. If your child is healthy and has no chronic medical illnesses or not on any medications, just a healthy kid, clean the wound. If you don't see anything deeper, just a regular scrape, soap and water, an initial antibacterial ointment, Band-Aid is fine. Make sure that they shower and keep it dry and clean and take the Band-Aid off. If the child has other medical issues that may predispose them to not healing well or other issues that are at hand, certainly contact your pediatrician immediately. And regardless of the underlying health of the child, if something isn't really healing or making progress by 5 days or so, I would call your pediatrician.
And it seems like if with kids and adults, the sooner something can be addressed, the better chance it is of a nice outcome. Dr. Jennifer Heller is the medical director of the Wound Center at GBMC and also the director of the Vein Center at GBMC. I just think we've got some great tips today. And notice in that last answer, you did not hear the words peroxide.
No peroxide.
So we are going to just dump that all down the drain. Thanks, Dr. Heller, for coming in.
My pleasure.
Really appreciate
Thank you.
it. And thanks for watching this special GBMC Facebook Live talk back here. And thanks for all your questions. I'm Christian Schaffer. I'll see you tomorrow morning on Good Morning Maryland at 4:30.